Going to discuss about newer oral anti-diabetic drugs. Every year one question is compulsory from this topic. The drugs that are going to be discussed today are, first one, important one is Glp1 agonist, and next one is Dpp4 antagonist, third group is pramlintide, next one bile acid sequestrant, and very important recent drug is sodium glucose transport SGLT co-transport inhibitor. Let us see each group in detail. First one, Glp1 agonist. Now let us know what is the concept of incretin mimetics. Incretins are nothing but hormones released after food intake to increase insulin secretion. Usually they are GLP, glucagon-like peptide. Glucagon-like peptide within the body is hastily metabolized by Dpp4. So either we need a group of drugs which will inhibit Dpp4 or a GLP agonist which is resistant to Dpp4. So the first group is Glp1 agonist. The drugs are exenatide and liraglutide. These are Glp1 agonist plus resistant to Dpp4. They stimulate insulin secretion, delay gastric emptying, and also decrease glucagon release, therefore maintaining glucose levels. Side effects are nausea, vomiting. When given with sulfonylureas, they tend to cause hypoglycemia. Another important side effect is pancreatitis. It can be necrotizing type. Coming to the next group, Dpp4 inhibitors. Drugs are sitagliptin, vidagliptin, olgoleptin, and saxagliptin. The side effects of these drugs are, this you have to remember, they can cause allergy, anaphylaxis, angioedema. They also tend to cause pancreatitis, and last one, they can cause T1 Johnson syndrome. So these are the important drugs. Now coming to the next important group, pramlintide. It binds to amylin receptor within the brain, and it tends to decrease glucagon. Very important to remember is, it is not only used in type 2 but also in type 1. Coming to the next group, bile acid sequestrants. They can decrease intestinal absorption of glucose, but precise mechanism of action not known. The drug in this is colesevelam. And the final group, it is sodium glucose transport inhibitors. So they tend to decrease absorption of glucose from kidneys. That is, they can increase renal excretion resulting in renal glycosuria, decreased body glucose. Side effects include, as there is renal glycosuria, it can act as an osmotic diuretic, resulting in increased urine and dehydration. Also, as there is increased glucose, more tendency of UTI. It is also known to cause hypotensive reactions. Drugs in this group are, please remember, dapagliflozin and canagliflozin. Friends, this completes oral anti-diabetic drugs. Thank you.